Opioid use during pregnancy has been previously linked to poor health in both moms and babies, including increased maternal death and other complications for the baby, such as preterm birth. The premise of the study was to really examine further some of these opioid-related diagnoses in pregnancies and maternal and neonatal outcomes using a much larger cohort than's been previously used in other studies. When we looked into this, we found that there were, significantly increased adverse risks for both mom and baby, including higher risk of high blood pressure for mom and increased risk for blood transfusions, as well as other maternal complications. For the baby, they had higher risk of infant death, preterm birth, neonatal intensive care unit admissions, respiratory distress syndrome, and a higher risk of neonatal abstinence syndrome. Most alarming was the fact that even over the past decade, with increased awareness of the complications of opioid use disorder in pregnancy, the rates of use in pregnant individuals in our study more than doubled. This really highlights the importance for multidisciplinary care to approach reducing the rising prevalence of opioid use. Unlike other substances in pregnancy, there's an effective treatment option for reducing adverse maternal and neonatal outcomes with opioid use in pregnancy. The issue of why the prevalence continues to rise is largely because of patient access, patient public awareness, and commitment from institutions, hospital systems, and clinics to support this level of comprehensive care. Historically, a lot of the prior studies have focused largely on the neonatal side of the conversation, especially on neonatal abstinence syndrome. And so this study really looks at both the mom and the baby and highlights that first, this is still an issue. The prevalence is still rising, and we need to focus our efforts on treating not just mom, but also baby, and also thinking about prenatal and postnatal care. This includes making sure that we have increased access for patients to be able to stop using their opioids and switch onto medication-assisted treatment, such as methadone or buprenorphine, the latter being the preferred because of better outcomes. It's shown to, improve fetal growth, decrease the risk of preterm birth, and reduce the likelihood of opioid withdrawal. And also, thinking about, complete care for mom in supplying, mental health support, as well as, postnatal breastfeeding support, and then focusing on, other approaches that will help with reducing the risk of neonatal abstinence syndrome, such as, having centers practice eat, sleep, console, a non-pharmacological approach with parental involvement to caring for newborns that are experiencing this. Increasing awareness in the public, as well as healthcare providers, helping them understand where are areas they can access care, how to refer, making sure these portals for getting patients in are streamlined, also educating families and care providers and caregivers what kind of symptoms they should look for in terms of when they are caring for infants that have been exposed to opioids during pregnancy so that they know what kind of developmental milestones they should expect. And so if the child's not meeting these within a certain time frame, to make sure that they contact their pediatrician or healthcare provider to get the baby in for early intervention services. Often opioids are used in combination with other substances This is called polysubstance use, which is also common in pregnancy. We're still learning about the effects of polysubstance use on the developing baby. Currently, it's not well known. Um, how polysubstance use affects each individual pregnancy, but we do know that depending on the type of exposure, the substance, timing, and duration, that can have varying effects on both mom and the developing baby. So, as we learn more about opioid use disorder in pregnancy, it's important to think about co-use with other substances, and potentially this is an area where we can target modifications to try to improve outcomes.